Well, I'd like to welcome our next guest on the program right now, Dr. Abbie Leibowitz, who is co-president and co-founder and chief medical officer of Health Advocate, one of the leaders in really helping employees make the right healthcare decisions within, for themselves and their families. Doctor, welcome.
How are you?
Great to have you on here. You guys were one of the leaders. I go way back with Marty, by the way. Back to my days, one of your co-founders. But give our audience, I think most people know Health Advocate, but give a little background on Health Advocate and where you are today in the space, and then we'll talk about using data to drive employee behavior.
Yeah, we started Health Advocate 16 years ago around the idea that healthcare was confusing and hard for the average guy to figure out. We thought it would be interesting to see if we could provide support to people facing any kind of healthcare issue. And that's 16 years ago. I got to tell you, nothing's made anything easier in the ensuing 16 years. So, but that was the model. The idea was that what would the world look like if anybody that needed help with a healthcare issue could call on somebody that had the time, the interest, and the experience to help them, and we put the company together around that model. 16 years later, that is still the core of what we do. We serve more than 11,500 clients across the country. They employ or have members about 10 million people. The service is always available to the individual employee, their spouse, their dependents, their parents, and their parents-in-law, which makes about 50 million people eligible to use our service. And we have today about a dozen other things that we hang on to that advocacy model, some of which we're going to talk about today regarding data. But we have a wellness program with 800 clients. We've got an employee assistance program with 2 million members. So there are lots of things that we do that go beyond simply the advocacy piece that we started the company around.
Michael, you got great information. I'm Dr. Leibowitz. There's a lot of great information that you're giving. You're breaking up a little bit on this end. I don't know if our listeners are getting the same. I don't know if there's anything that's on your phone that might change to be helpful if you're on a speakerphone. But
all right, let me try it. I was using a headset, so I'll try it direct, and maybe that'll be better.
Okay. Can you hear me?
Yeah.
Okay. Can you tell our audience a little bit? You talk about data analytics. What does that really mean, and how do you use data analytics, and what databases are you using that might improve employees' health care?
Okay. So let me paint it to you this way. When we first started the company, we trained our people so that when somebody would call in, let's just say they called in because they had a question about a bill, that we could say, we'll help you with that bill, but what other medical conditions might you be dealing with? Because the only reason that somebody got a bill was because they needed health care. And while a lot of that is, one and done sort of stuff, I sprained my ankle, I had a cold, that kind of thing, much of it relates to an ongoing or chronic need. So we, from the very beginning, were always looking at the opportunity to extend the discussion into a health-related interaction. I thought it would be neat if we knew that, for example, you had diabetes before we picked up the phone to talk to you, so that regardless of what our conversation was about, we might be able to weave in something relating to diabetes or heart disease or whatever. To do that, we bring in medical claims and pharmacy information, self-reported information from a personal health record, the results of disease management programs, ours or somebody else's, biometric results, whatever we can get in terms of digital information. And we build an administrative patient record so that we can identify things about the people that we're dealing with and highlight gaps in care or benefit opportunities that might apply to them. So that when I answer the phone, I know not only that you're an asthmatic, but that you've not filled your prescription for your rescue medication, or you're using a brand name that's not on formulary when there's a cheaper generic that you could take advantage of. those kinds of things. And so while I'll still help you with anything that you need my help with, I get the chance to say, by the way, how about your asthma medicine? Would you like my help in getting your prescription refilled?
So the benefit to employees and their families is, smarter decisions around care, smarter decisions around cost, correct?
Exactly. And importantly, we think we're making a difference in the way that people not only use the healthcare system, but look after their own health. It's a much different relationship that you can strike with somebody when they pick up the phone and call you, as opposed to when you pick up the phone and call them. So when somebody says, I need your help and I'm going to, call you on the phone, I'm going to talk to you about it, they're far more receptive to the message that says, by the way, I can help you with this additional thing.
Dr. Leibowitz, a lot of people struggle with the kind of information that you're providing and service you're providing with programs that are integrated directly with, say, their insurance carrier versus getting somebody who's sort of a best of practice outside, maybe like you guys are. I notice a lot of your folks, and even your senior leadership, are sort of ex-Aetna folks. Can you describe a little difference between, sort of an outside separate organization like yours versus somebody who has it carved in and integrated with the rest of their program?
Yeah, and you're right. When I originally put the company together, I brought together 5 people that had worked with me in our roles at Aetna and U.S. Healthcare before that, and people I knew in the industry. And we were really ideally positioned to understand the benefit side of the world. And, of course, as a physician, I understood what it's like to treat a patient and deal with clinical issues. So that aside, we presented ourselves as an independent advocate. We have no vested interest in anything other than getting the person to the best possible outcome. And I think that's important. And it's not to disparage the health plans. I think the health plans do a great job, but a lot of the interactions that we have with people are because they didn't get what they thought they should get from a benefit perspective from the plan, rightly or wrongly, or they have a general mistrust of the motivation behind the message of the health plan. And while I want to emphasize, I think the plans do a great job, and I think a lot of that perception is misplaced, it's there nonetheless. And so the idea that we're not the health plan, that we're not bundled into part of your benefit, that we're not looking after our own well-being, but rather yours, is a very big difference when we go out into the marketplace.
Can you tell our audience a little bit about what your business model is and your target market? How do you charge for the service? Is it PMPM or some other basis so they can understand what sort of the costing might be?
Yeah, it is typically a per employee per month model, not strictly a PMPM model, although we do some work with some plans and distributors that are on a PMPM. But that's just a way of looking at the per employee cost a little differently. So it is a per employee per month model. The core advocacy service is a service that sells in the marketplace for about $1.50 per employee per month. It's much less expensive to very large companies. We have a number of distributor relationships as well with all the various distribution players and consulting houses. We're in several of the private exchanges. We're in several public exchanges through health plan partners. So we fit in lots of different places. But we like to say it's an inexpensive service that provides great value. When you look at healthcare premiums today in the $8,000 to $12,000 per family per year range, you're looking at Health Advocate as a service that most employers can put into their benefit program for $15 to $18 a year. That's just not, it pales by comparison to the benefit that we offer. And then, of course, we do we do have other services like wellness and pricing transparency tools and employee assistance programs that are priced in addition, but always on a PEPM basis.
What size employers are you typically targeting?
Yeah, we have 11,500 clients, and that counts directly contracted clients only. So if we do business through Independence Blue Cross in Philadelphia or Blue Cross Blue Shield of Michigan, and they've got thousands of clients, we count them as one. So lots of clients. We have 6,000 clients that have fewer than 100 employees. So we're very familiar with things in the small market, the middle market, and very large markets as well. We have go from customers with 2 and 3 employees to customers with 350, 400,000 employees, and everything in the middle. But I would say our sweet spot is the point at which an employer first becomes interested in being self-insured. That varies by market and literally year to year sometimes. So it runs somewhere in the, I'm going to say, 700 to 2,500 up to 5,000 employee lives. That's kind of the sweet spot of the market for us.
Doctor, it's been great having you on the program, and we really enjoyed this discussion. Really appreciate you taking time out of your day to join us and kind of share your insights. I'd like to give you a chance to leave our audience with a few takeaways, if you would, please.
Well, I think the key element here is that healthcare is confusing, and the result of that confusion is inefficiency, costs that are higher than they need to be, and outcomes that are less discrete than they ought to be. It's a very, for whatever the benefit side of the story is, as confusing. With deductibles and coinsurance and narrow networks and all that. The healthcare delivery system, the medical care system, is just as fragmented, just as confusing, and just as difficult to navigate. So anybody who crosses the line from being an interested observer of healthcare to a patient in the system understands exactly what I'm talking about. The idea of finding and using somebody that can help guide you through that world is extremely important. We certainly, we provide a channel for that in our own way, but there are many other ways that the individual consumer can look at how they can get help in the system, whether it's from their doctor, from a friend, from a family member, from their health plan. But it's very important to have somebody that you can work with.
Doctor, I really appreciate it. Thanks for joining us. You have a great weekend, and we'll talk to you again real soon.
Thanks for inviting us. That's great. Take care.